My name is Beth Turner. I'm a physician assistant. I do general orthopedics, and I also work with a foot and ankle specialist as my attending physician. I've always been interested in medicine. You get to learn something new every day. It's basically you're presented with a patient's problem, and it's your job to find the solution, and it's challenging and very interesting, and I look forward to it every day. 3 days a week I see general orthopedics, all conditions, and then 2 days a week I'm with my physician and we see foot and ankle problems solely. I think with the foot and ankle especially, there are folks that come to us that have been crippled for years and just can't walk without severe pain, and we're able to, through my surgeon and other treatment options, allow them to walk and be active again, and it's very rewarding. At Duke, we have so many specialties. It's not, even if we don't know exactly what's going on with the patient, we always have resources to assist in treating patients. We can always refer them to other specialties once we try to work them up for a specific problem.